A massive COVID resurge coupled with multiple mutations has gripped entire India. The country has reported over 200,000 cases for successive days. The only reprieve has been a lower fatality rate. Delhi has ramped up vaccination drive and state authorities have scrambled to impose stricter curbs.
A record surge in fresh COVID infections is challenging the health system of India. While the mortality rate has been low in the country, a swift infection rate has compelled the state governments around the country to take strict measures to contain the spread. Capital New Delhi has imposed weekend curfews under which all services, barring essentials, will remain suspended on Saturdays and Sundays. The state with the highest cases, Maharashtra, has imposed lockdown-like restrictions until the end of the month. Other states too have come up with strict measures. Meanwhile, the health teams on ground are racing against time to vaccinate everybody in the age brackets. The administration has laid special emphasis on the far-flung areas where the infection rate is not intense, but complacency could prove disastrous.
We have organized the vaccination session and screening of working people in this rice mill. Here we vaccinated some few people above the age of 45 years with the document of election card and driving license and other.
With the virus raging in the country, the only hope that remains is a ramped-up immunization. As part of the vaccine outreach, healthcare workers travelled in an auto rickshaw to reach a rice mill in Bavla village on the outskirts of Ahmedabad city to vaccinate workers at the site. With over 14 million cases, India is the second worst affected country, trailing only behind the United States. The only reprieve amidst the crisis has been a low mortality rate and a fast recovery rate. In order to accommodate more patients for treatment and to provide isolation facilities, several spaces ranging from banquet halls to indoor stadiums have been converted into quarantine centers.
देखिए अभी जो जिस टाइप से केसेस बढ़ रहे हैं, लोगों को हाइपोक्सिया हो रहा है, ऑक्सीजन की बहुत कमी हो रही है, शहर में भी ऑक्सीजन की कमी हो रही है। इस बेसिस पे लास्ट ईयर भी हमने ये जो सेंटर स्टार्ट किया था, उस टाइम यहाँ पर ऑक्सीजन की उतनी सुविधा नहीं थी, पर इस बार 370 बेडेड हम लोग जो बनाए हैं वो सारे ऑक्सीजन सिलेंडर्स युक्त हैं। ऑक्सीजन की निर्बाध सप्लाई का वादा किया गया है और हम करेंगे। कोशिश रहेगी कि मोर्टेलिटीज़ कम हों, लोगों को ऑक्सीजन मिलती रहे और लोग की ज़िंदगी बची रहे।
India has so far administered more than 117 million doses. However, with the contagion accelerating, India is also set to give permission to more vaccines. 3 vaccines, India-made Oxford AstraZeneca vaccine, domestically developed Covaxin and Russian Sputnik V have already been given emergency authorization. India has for now delayed exports of large quantities of vaccines, though over 60 million doses have already been shipped.